iGlaucoma presents Podium Presentations on Glaucoma Rewind for national presentations that were missed or those you watched but wish you could press rewind and watch again. In today's podium presentation, the talk was presented at the annual American Glaucoma Society meeting in Nashville, Tennessee at the Meaningful Patient Engagement Symposium. Today I'm going to be talking about communicating with patients and why it matters. These are my financial disclosures. In talking about communication, we first need to begin with how we define communication. It's the imparting or interchange of thoughts, opinions, or information by speech, writing, or signs. The two key words in the definition are imparting and interchange, which implicates the need for interchange between two or more people. The problem with glaucoma and poor communication is that it can lead to blindness. In this chronic condition of glaucoma, we have to get communication right. Some of the major factors posing potential problems to communication in glaucoma is that it's a very complex disease. It's complex even for us as providers, let alone being complex for patients, and the regimens can also be very, very difficult to keep up with. Time is also not on our side. With the modernization of medicine and needing to see more patients in less time, trying to communicate effectively in short periods of time can be even more challenging. But we must rise up to the challenge and utilize our time wisely. We need in a short period of time to gain the patient's trust, to gain the patient's confidence in our skills and our abilities to help treat them, as well as show that we care. In a study that was looking at 100 patients from the UK who had glaucoma, they were asked about their drop regimen. 1 in 5 of those patients had incorrect eye care regimens. Why? Because of poor patient-provider communication. Part of the reason why it's so vital, because we know if patients aren't adhering to the regimen, they can lose vision. When we look at patients and doctors, how we understand each other, there was a study that looked and did focus groups with doctors and patients, trying to understand how each other perceived health beliefs and values. 3 of the most important themes from the doctor's perspective of how patients look at health beliefs and values is they were thinking that education, trust, and culture were the most important. When asking the patient from their perspective what they felt that their health beliefs and values were, by far the highest was bi-directional communication with their doctor. So the patient-provider relationship is one that is needing to be based on multidirectional conversations. So the type of patient that we might have had a majority in the past, where we could just tell them what to do, expect them to listen and obey, and not to ask any questions, is not the type of patient that we need to be focusing on. Because by and large, we're finding out that to have a good patient-provider relationship, we need to have the shared decision-making, because this is going to be vital to effective care. So the type of patient who we need to explain what's going on, to answer their questions in a way they understand, and allow them to feel involved in the decision-making is where we need to focus. So what does good communication look like? Well, a paper evaluating the relationship between doctors and how patients perceive who's a good doctor states it well: when your doctor gets it and when their doctor gets you. So the portion of the gets it is the patient's perception of the doctor having medical education, having good competency to treat the patient, and being able to intellectually know what to do. But in terms of getting it, or getting the patient, this means that the doctor has some level of warmth. They care about the patient as a person. They make eye contact with them when they're speaking. They pause so that they can actually listen, and they ask questions so they can understand. So again, bidirectional communication and allowing a patient to know that you care. So how do we do this? Well, one of the easiest ways is to use education, because education empowers the patient. By educating, we empower the patient and we allow them to understand a complex condition, and then they feel enlightened. As they feel enlightened, they have a better ability to ask better questions, and they feel encouraged about taking more control of their disease, and this builds trust and connection. And then these things ultimately lead to action for the patient to be able to take care of their glaucoma. So in conclusion, poor communication can lead to blindness, and it's vitally important for us to practice good communication, which means bi-directional conversations. And for us to be most effective, we can't just get it, we have to also get the patient. And education is going to be critical to the path of understanding, trust, and taking action, which will ultimately lead to saving sight. Thank you.
Want more videos like this? Check out the iGlaucoma YouTube channel library. Check out the upcoming Season 2 of MIGS Success Surgical Secrets, where a video of common challenges and solutions will be featured. Subscribe to the channel so you won't miss it. Hey! Want a must-need glaucoma tool that you can download right now? Grab my 2022 Glaucoma Medication Guide in the description box below. You'll get all the most commonly used glaucoma medications right at your fingertips to help you quickly make decisions about which glaucoma drop is right for your patient. Download it now! Thanks for watching the iGlaucoma YouTube channel, a place for glaucoma innovation made easy for eye care professionals.